Welcome to the Epilepsy Monitoring Unit. I am JF. I will give you the tour of this unit and tell you what we're all about. So this is the nurses station right here. We have 7 rooms. 2 of them are surgical suites because not only do we diagnostic part, but also surgery diagnosis to determine what epilepsy is about. So we have the nursing unit right now. Right over here, we have monitoring station. This is for the nurses to be looking at the patient condition live, because we can see the clinical aspect of the seizure while the technicians will look at the visual, audio, and also the EEG aspect of the seizure. So 5 of these rooms, they're all monitored. You come in on a specific day. You are ordered by your physician or neurologist specifically for epilepsy to be determined what is it you have, what is it you've been having for years or recently. Maybe it's a genetic problem, maybe it's from an accident, or maybe it just happened just like that. So you come here for normally 3 to 5 days, and during those 3 to 5 days, the doctor will titrate down your medication to make you more susceptible to have a seizure. Why we do that is to be able to find out where the focus is in your brain. Once we know the focus, then we're able to treat you better, whether it's medication or whether it's surgical. For instance, we have a comprehensive programs that not only treat epilepsy, but also treat other kinds of problems related to seizures.
Hi, my name is Ms. Guzman. I'm the unit secretary here at the Epilepsy Monitoring Unit. My role here is be contacting you for your appointment, either a 23 EEG or your phase 1. Normally, I will give you a call a few days before your appointment to set you up for a COVID test. A COVID test is something we do here due to your admission before. If you're not able to get it done 2 days before your admission, you'll get it done here at the unit. Even if you are vaccinated, we are still required to do the COVID test. When you come into the admission, I'll be the first person you see in the I'll be the secretary in the front. You arrive here to the Epilepsy Monitoring Unit, we will assign you your bed. Also, whoever comes with you will be welcome to come to our little lobby that we have here. We have our coffee machine. We also have some snacks that you'll be able to get by yourself or your visitor. Also, we have a little area where we have our TV.
All right, so let me show you the nurses station right here. We have several monitors that we can adapt to 7 different screens. Each room has 2 cameras. They're all pointing towards the bed. One of the camera is visible from our station. No audio or EEG. This is all left to the EEG technicians that are in a separate room. So we have 2 nurses here. One of them constantly watching videos while the other one is writing notes or visiting patients' room during that time. This is also here that we receive the alarms coming from either the patient's room. A family member can press alarm button. The technicians can press the alarm button. Or if you see something off on the screen, a behavior is not according to a normal behavior, then we jump in and we go to the patient's room. Okay, this is an emergency. We understand that when patients come here, they're very vulnerable because we titrate down their medication to see more of those events happen so they can be better diagnosed and treated in the future. Let's show you a patient's room. So this here is a typical epilepsy monitoring unit room. Okay, it has the bed to its lowest setting. Why the lowest setting? Because we bring them to a point that they might they might have an accident, a fall caused from a seizure, or whatever else is happening. Okay, we also have padded side rail to prevent them from having injuries, especially during a generalized tonic-clonic seizure. Okay, we also have all the equipment used to connect the patient to the EEG. We also have an IV pump and pole because some of our patients may decline to a point where their seizures are not under control anymore, and they may need to be brought back to normal by giving medication to help cut the seizure. If the patient has had too many events and the medication is not enough, or we want to reestablish a proper level of medication, we give it intravenously. And that's what we use it for. Also, we may have patients post-op in this room, meaning that they remove the focus of the seizure surgically. Therefore, they need a day or two of antibiotic before they head home. So this is your typical setup for a visitor to come in and spend the night, as well as our patients lots of time need some reassurance, and it's best to have a family member. Family member can help us tremendously to determine if what they see during an event is what is actually happening at home. This couch pulls out completely, and they can sleep here no problem. There's accommodations for the families while they're here. There's a coffee machine, tea, hot cocoa, there's snacks, microwave, there's a refrigerator for the family, so everyone's welcome. We allow one visitor overnight, but also more than one visitor during the day, if that's what that can help them to go through these 3 to 5 days. Another aspect of this room is I've mentioned earlier about us nurses looking at the patient's condition, okay? Because some of those seizures are very obvious on camera, and we jump in. Some of them are not so obvious, but this is happening with these 2 cameras, okay? One in each corner, and they can alternate between the 2. As we assist the patient during the seizure, we'll be at the patient's bedside. And sometimes during the type of seizure is not conducive to see 100%. So we always have an excellent view of the patients because they're cross, and we can actually see if patients on one side or the other side. There's also a module for night vision, as sometimes seizures happen quickly at night, and we always have a good view of what's going on.
Hi, my name is Robbie. I'm a Royal Herman registered EEG tech in the Epilepsy Monitoring Unit. Today I'm going to be showing you an example of how we set up an EEG on a patient here. So an EEG is a test that measures the brain activity. It's similar to the way you have an EKG done with a similar type of electrode system. We'll be attaching all these wires to your head. We'll also be putting on respiratory belts to monitor your breathing, and a pulse oximeter to measure your oxygen levels while you're here. You can be getting an EEG for a lot of different types of reasons. It could be for epilepsy, unknown seizures, or for even dementia and loss of consciousness. So to prepare for your EEG, you'll want to wash your hair the night before, but make sure not to use any hairspray, conditioner, or gels. Because whenever we prepare your EEG, we'll be measuring and marking with the crayon and the measuring tape. We'll be using a gentle scrub to exfoliate your scalp. And then we'll also be using a conductive paste to make the electrode stick. After we use that, we'll be also adding an extra adhesive to make sure that they stay overnight and for a couple of days as well. So for COVID safety, all staff and patients will be required to wear a face mask. So the first thing we'll do is measure and mark your head. Everybody's head circumference will be a different size, so we want to make sure we evenly place these electrodes on your scalp. To prep for the electrode, we'll use our scrub as well as some paste. We'll clean the spot. Get some paste. Get one of our 26 electrodes. We have our adhesive here that we'll use. And place it over the electrode to hold it down. So the electrode will stick on its own with this adhesive, so you won't need to cut your hair for it to stick any better. So after we put all 26 of these electrodes on, we'll put our respiratory belts and our full socks. So you'll have 2 belts over, one over the chest here, and one over the abdomen here, as well as the full socks. The pull socks will be plugged in separately, so you will need to ask your nurse if you need to go to the restroom to unplug this for you. So this is our EEG monitoring system. All your waveforms and your breathing patterns will display here, as well as both cameras for your safety. The techs will be watching the EEG as well as the camera, and the nurses will be watching the camera. Someone will be monitoring you 24/7. Now let's take a look at our tech control room where we'll be monitoring you. This is our tech control room where we monitor all of our patients in-house and outside hospitals.
Hi, my name is Arnold Balabano. I'm the nurse manager for the Epilepsy program. We talk about safety today. So as you can see, we want to put some rest on our patient to prevent any falls. We also give our patient a push button, which is right here. So the patient can always, in a seizure, press this push button that will alert the nurse and EEG text. So as far as the push button, the patient can push the push button, the nursing staff can as well press the push button, and the techs can also press the zero button from the tech room. As we go in the room, we can see we also have oxygen for patient in case of a big conversion section. So for patient safety, we also use those pads that you can put on the patient's back that connects directly to a bed alarm system that we can connect right here. So whenever the patient tries to get up, the alarm would go off, and the nursing staff will accompany the patient from the bedside to make sure the patient is safe. To protect our patient during a seizure, we want to put those safety pads on each side in case of a conversion. We like to put these sideways up just to prevent any safety issue. And then we have also this one up as well. We try to keep one lower to give the patient some mobility. So if the patient needs to use the restroom, we highly encourage patient to use the call light to call the nursing staff to the bedside, call the patient out of the bathroom by pressing this button here. And this would alert the call station, and the nurse would be able to call you the patient from the bedside and assist the patient to leave the bathroom. We're going to add Mr. Marius to the bathroom. So we're going to first disconnect, grab this EEG bag right here. There's enough cable, and then disconnect the pulse ox. Then we'll of course open the door and switch on the light. And then I see the patient and unit to the bathroom. All right, Mr. Reyes, are you okay? Yes, I'm good. Thank you. All right. And so as a safety measure, the nurse will stay out of the room and keep a foot on the door just to make sure the patient is okay. And we'll try to ask the patient if they're okay, like every 10 seconds, 30 seconds. Are you okay, Mr. Marius? Yes, I am. All right, good. Okay. I will stay here just behind the door, just for your safety, okay? Okay.
All right, he's staring at this point. Okay, Herman, go. Here. Starting, what you see. His eyes are midline.
Suction, please.
Left leg is shaking.
Suction, please. Drooling.
Eyes to the right.
Hands are flexed.
Body is very tense. Tension is more relaxed now. How are we looking back there? And he's relaxed. Seems to be breathing on his own. Oh, he bit his tongue. All right, so we're gonna position him in a safe position. We're gonna get another pillow. All right, we're gonna call the doctor.
Are you okay? Yeah. Tell me your name. Patient not responding, full sacral. Hi. Oh, can you tell me your name? Steven. Hey, Steven. How are you doing? You know what happened? You had a seizure, okay? You know where you are right now? Do you feel any pain? Do you feel any numbness, tingling? Feeling nauseous, okay. All right, well, no, I'll refer you to the doctor, see what's up and see what we can help you with, okay? All right.
My name is Jen Rivera. I'm working here in pediatric epilepsy of Memorial Hermann. You can come in here. We have 6 patients here that we use for our children, where we do the epilepsy monitoring, and this is the nurses' stations. This is the typical PEMU room. We have a monitor. This is our EEG monitor. At the same time, you could see all the stuff in here. And we have a bed and for the patient and for the family. And it's pretty comfortable. And also a video camera that is real time that we take for the patient. This is our playroom. If our patient is portable, you could see here that this is where they play, and we have a camera at the same time that they can spend time here while they are being monitored at the same time.
So this is our technology for teenager kids. And if you follow me, you can see we have Xbox, PlayStation for teenagers to spend some time here while we monitor EEG. They can also play piano. We have some drums, guitars for kids to play music. So every Friday, the kids can gather together, and we have the screen that can project movies. As you can see on that ceiling, there's like a screen. The screen will go down, and the projector, and kids can enjoy a movie and cartoon on Friday.
Welcome to the pediatric EMU sex monitoring room. In this room is where we monitor all of our patients who are on EEG. We have 6 pediatric EMU rooms. This is where we monitor all of our patients. Also, we are able to monitor patients who are in the ICU, as well as on the other floors of the hospital. And we have a monitor on the wall where we can live monitor our patients. Also with these monitors here, we are capable of live monitoring any patient around the hospital who's hooked up to EEG as well. Previously, we showed you a playroom where our younger folks can go and have a decent hour away from the room when they are on EEG. This is where we monitor those patients. So this is directly connected to our children's playroom.
Hi, I'm Dr. Chaitanya Gane. I'm an intracranial EEG fellow here at UTHealth Houston. I'm a physician scientist by training. The work we perform at UTHealth goes over and beyond managing patients with medications for their seizures. UTHealth boasts a level 4 epilepsy center, which means we perform a thorough evaluation to find a seizure focus and offer surgical treatment leading to seizure freedom. The evaluation and treatment are tailored to each individual patient's needs. We are striving to improve this care by significantly investing our time and efforts in epilepsy research to improve the quality of life and seizure outcome in persons with epilepsy.
Hello, my name is Andy Tran. I'm one of the clinical epilepsy fellows here at UT Houston. And the reason why I chose UT Houston was for many reasons, but the most important reasons are because UT Houston is a level 4 comprehensive epilepsy center. So there are numerous ways to evaluate and ultimately, hopefully treat patients with epilepsy so that we can better their lives. Some of the things that I do on a daily basis is to make sure that we review all the EEGs on patients that are in our EMU, the Epilepsy Monitoring Unit, as well as learning and grasping the concepts of epilepsy and getting firsthand teaching lessons with our epileptologists who are amazing in their own right. My future plans in the coming months, once I graduate from this fellowship, is to go into the community and treat patients with epilepsy, primarily in the hospital setting.